Hi, my name is Dasjia RT, and I am a respiratory care student at Baptist Health Science University. Today we will be intubating this patient. His name is Mr. Jones, and the reason for intubation is to open up the patient's airway to improve the patient's ventilation as well as oxygenation. Indications for intubation may include if the patient is unable to protect their airway, if the patient is in acute respiratory failure, which is indicated by a pH below 7.25 or a PaCO2 above 55 millimeters of mercury. It is also indicated if the patient has inadequate lung volumes, which is indicated by tidal volume below 500 milliliters. Hazards and risks of intubation may include failure to establish a patient's airway, failure to intubate the patient, hypertension and bradycardia secondary to vagal stimulation, and also breaking the patient's teeth. I now have on my required PPE, which includes my gloves, my gown, my face shield, and my mask. I have my laryngoscope handle, the Miller blade, the Macintosh blade. I have my tape. I have my commercial tube holder and my security device. I have my colorimetric CO2 detector. I have my lubricant, my 10 millimeter syringe. I have the ET tube in the solid. I have my stethoscope. I have the bag valve mask hooked up with the mask. And I also have my suction equipment hooked up. I am going to begin with checking the integrity of my cup, and I'm going to check the integrity by inflating the cup. I put 6 millimeters of air into the cup to check the integrity. I'm now going to lubricate the distal end of the ET tube. The distal end of the ET tube is now lubricated. Now I'm going to decide whether I'm going to use a Miller blade or a Macintosh blade. A Miller blade directly displaces the tongue, while the Macintosh blade indirectly displaces the tongue. I'm going to check and see if my light works on my blade. And if it doesn't work, you can replace the batteries or you can replace the handle. I now have my patient in the sniffing position. I'm going to begin by suctioning my patient in the mouth. I'm going to now ventilate my patient for 3 to 5 minutes using the EC technique. And I'm looking for bilateral chest expansion. It has now been 3 to 5 minutes, and now we can attempt to intubate. I'm going to sweep the tongue out the way and indirectly displace the epiglottis, and I'm going to advance it to the vallecula, and I'm going to look for the vocal cords. I have 30 seconds to attempt intubation. You have to hold your blade in your left hand. I'm now going to inflate the cup. Okay, we can check placement of the ET tube by observing the chest for equal bilateral chest expansion. We can also look for a change in the color in the color matrix detector. It should change to purple. And you can also listen to the breath sound. Now we're going to secure the tube. This is a male. We have placed the tube at 23 centimeters at the tip.
What's your name? Structure, okay?
The ET tube is now secured, and now we are ready to initiate mechanical ventilation. This video was possible with the resources provided by the Respiratory Care Program. I would like to give a special thank you to the program chair director, Ms. Kira Anderson, for orchestrating the time for this video to be produced.